Hi, my name is Ashley Gray. I'm one of the nurse practitioners from the CNC Health and Wellness Clinic. Thank you for attending my talk today on women's health. So contraception. So that really depends on obviously your goal of fertility. So whether you're planning on getting pregnant in the short term, whether you're planning long term, you want to be not getting pregnant, whether or not you want to be on hormones or not on hormones. This is really about family planning and allowing you to take the lead and allowing you to finish your schooling if that's what you'd like to do. So the number one recommended contraception is long-acting reversible contraceptives, or LARCs. So the great thing about these is we put them in and then you can forget about them. And they're good for like anywhere from 3 to 10 years. And you pay for them like upfront, and then they really pay for themselves over the next few years. And when we take them out, you have instant back to fertility. So people really like these because you don't have to remember to take a pill every day, which often women forget to do. So we have 3 options of LARCs in Canada. We have copper IUDs, which are non-hormonal. We have hormonal IUDs, and we have a new implant, which not too many people know about. And the nice thing about that is you don't have to have a speculum or a pelvic exam, so it just goes in the back of your arm. So again, all these options cost a little bit more money up front, but if you have the CNC student healthcare plan, you actually get them paid for 80%, and then it's actually really cheap options for you to get all of these. So the IUDs, again, we can put all of these in at the CNC Health and Wellness Center. The IUDs, they're maybe 15 minutes to put in. They do require a pelvic exam, so we do put a speculum in, we put a little bit of freezing in, and then we have to put that in. The implant is we freeze up your arm, and it's a minute to put in. It's so fast. Next slide. So copper IUDs, $70. The short ones, you get 5 years. Longer ones, 10 years you can get out of them. So for women who've maybe already had their families and don't want any more kids for 10 years, this is a great option. That's 7 years you've paid per year for contraception. This is the best deal out there. However, if you have heavy menstrual bleeding and heavy cramps, this is not a good option because copper IUDs actually increase bleeding and cramps. So for women who have lighter periods and minimal cramping, copper IUDs are great options. They are not only non-hormonal LARC, so they don't affect your mood, acne, or increase weight. And with any IUD, precautions are migration and expulsion out of the uterus, perforation of the uterus. These are very, very, very minimal risks, but we do tell everyone that. Infection, because of course we're putting them into a sterile environment, which is your uterus. And all of these things don't protect against STIs. All right. Our hormonal IUDs, we have the Mirena and the Kyleena. The biggest difference you can see between these are the Mirena is a bit stronger than the Kyleena in the amount of hormone. The Mirena is a little bit bigger, so we actually recommend that for women who have had kids. And the Kyleena is a little bit smaller in size, so women who have never had kids, it's a bit easier to go in. Otherwise, they work in the exact same way and they cost the exact same thing, and all of the advantages and disadvantages and complications and everything else is exactly the same for the two of them. So they work by preventing fertilization by thickening the cervical mucus so that sperm can't get in there, and then they thin the lining of the uterus so that pregnancy can't implant. So that's basically how they all work. Again, advantages is that these actually work pretty well for decreasing menstrual flow and cramps. And so you can actually you can stop having a period with the Mirena. So some people really love that. You can get an increase in spotting and things in the first couple of months, and then it can actually go away altogether. So some women like that they don't have a period anymore. Some women that they actually don't like that, and that is just a total preference to every woman is different, and that's okay. Some disadvantages, it may affect weight because this is a progesterone only product. It may affect people's mood, it may increase acne, it may change your libido, and it may increase vaginal discharge. But again, every woman's different, and because the amount of progesterone is pretty low, it generally doesn't affect these things too much. All right, next slide, please. So as you can see, the implant is about 5 centimeters, goes into the back of the fatty tissue of the arm. It's really great for women who don't want to have a pelvic exam. Pretty quick to go in. Again, it's progesterone only, so it just thickens that cervical mucus to prevent fertilization and ovulation. It has the advantages, it decreases that cramping and menstrual flow because it's a progesterone only product again. However, one of its disadvantages is because it's progesterone only, it may increase spotting, and it may do it for up to 9 months to a year. So the ones I've put in for women, that's their main concern, is that spotting has lasted a little bit longer than in the Mirena. And let's face it, for most women, we don't want to have spotting every day. That's a little bit annoying. It ruins a lot of our underwear and things like that. Precautions, migration, it can go places, but again, there's not a lot of places it can go. Infection at the site, and it might not be feelable. Next. Short-acting hormonal contraceptive, so that's the pill. We also have a patch that goes on once a week, and the NuvaRing, which is a flexible plastic ring that goes into the vagina, and it's good for monthly, so you would replace it every month. They're all combined estrogen and progesterone. So with the addition of estrogen, we can't use that in women who smoke and are over 35, women who have migraines, some women who have gallbladder issues, who have clots. So estrogen is a bit more of a dicey hormone, so that's why the LARCs are much more acceptable to most women, whereas estrogen causes a bit more problems. However, estrogen also decreases the amount of acne women have. It also helps with if you get PMDD or premenstrual anger and dysphoria and moodiness before your periods. Estrogen can help with that. So sometimes women like to have the estrogen piece because it helps with some of those side effects that we get if we're just on progesterone. You also don't get as much spotting when you put estrogen in. All right. We have short-acting progesterone. So we have Depo-Provera, which is a shot every 3 months. People like that because then there's not as much to forget. You don't have to take a pill every day. But people who don't like shots should not get a shot into their muscle every 3 months, obviously. And it can cause some spotting. The other thing with Depo is your return to fertility is not as good. So some women have noticed that while everything else, once you stop it, generally your fertility comes back almost instantaneously. Depo, sometimes it can take up to a year, actually, for fertility to return. So some people don't like that. And the progesterone-only pill. So some women still like pills, which is great. It is the only pill form of just progesterone that we have on the market. The disadvantage to that is it is a very narrow window. So when you have the just regular birth control pill and you miss one pill, you don't have to use a backup method or anything like that. You just take your pill the next day. You have to take this pill within an hour of when you normally take your pills, or you have to use a backup method for like 7 days because progesterone is not as kind without that estrogen piece. So like it is, and progesterone makes people very nauseous. So it is not an easy birth control pill to take. Next. Non-hormonal contraceptives. I just wanted to mention, of course, that the only type of contraceptive that protects against STIs are condoms. And we have 2 types of condoms. I'm not sure everybody knows that, but we have male condoms and female condoms. So they do have higher failure rates because there's more chances that they may break or slip or that kind of thing. But you should use them together with other types of contraceptive because they protect against STIs. All right. And then here are some contraceptive resources that I've given you. So the first 2 are from the Society of Obstetricians and Gynecologists of Canada. So they're highly recommended. What I like about them, the Sex and You one lays out every single contraceptive I've given you there and all the pros and cons of them. So it's a fabulous website so that you can see in really plain language with really good visuals why you would choose the contraceptive you would choose. And the It's a Plan one, you can put in your specific details and it will help you choose a contraceptive that's right for you. So it's a really great website. Pregnancy. So let's talk a bit about that. Just so you know, I do prenatal care. So if you find yourself pregnant, we are able to do up to 20 weeks of prenatal care here at the Health and Wellness Center. So I just wanted to talk a bit about preconception. And if you're thinking about becoming pregnant, then you should be thinking about taking your multivitamin. You can switch the slide. That has at least some folic acid in it, and making sure you have a diet rich in fiber and high-fat dairy and iron, because iron is very good for babies. They need a lot of iron because your blood, when you get pregnant, your blood capacity increases, and then because you're giving some to the baby. And so if you have low iron to start with and then you're giving some to baby, then you and baby are kind of both deficient. So that's really important to think about. Obviously, it's important to think about stopping or reducing smoking and alcohol and cannabis use. It's important to treat any dental problems, just because the mouth is actually a conduit for bacteria and things. With pregnancy, that's a really important aspect of care before pregnancy. And then immunizations. There's some immunizations you can't get when you are pregnant, so making sure those are up to date before you get pregnant. And then exercise. Anything you do before you get pregnant, you can continue on when you are pregnant, so making sure you're just healthy overall is important for pregnancy. So first trimester, I just want to talk about things like fatigue and nausea and breast tenderness, and things like that we often think about with our periods are very common during that first trimester. Frequent urination, backaches, headaches, cramping, those things are all very common in the first trimester. We usually meet with you once a month when you are pregnant in this first trimester. We get you your first ultrasound to date your pregnancy, so you will know when you're pregnant, because most people often get very sick and miss that first period. And then once you've missed that first period, then we order your first ultrasound, and then it's called a dating ultrasound, so we know how far along you are. We offer you genetic screening that is free. And depending on your age, that may involve an extra ultrasound, just depends. There is some genetic screening that you can do, that you can pay for, but we can discuss all that. Obviously it depends on your risk and things like that. And then there's screening lab work. We look for anemia, infections, thyroid issues, blood compatibilities, that kind of thing. Okay. And then halfway into like your second trimester, that's when we would send you to the doctor that would deliver you here in Prince George, because I don't do that. But we do have a Doppler here at the clinic, so you would be able to hear the baby's heartbeat here. And we order you your detailed ultrasound, which is where they go through all the systems of the baby to check to make sure their heart and their limbs and their brain and everything's good. And that's when you would be able to know whether or not the baby is a girl or a boy, if that's what you'd like to know. We would order your oral glucose tolerance test. So that's where you can find out if you have gestational diabetes. You have to take this really sugary drink. And then at 24 weeks, you start to see your prenatal provider every 2 weeks. Next slide. And then third trimester, you will see your healthcare provider weekly as you get nearer your due date. You have to do a swab to test for group B strep. That's a type of bacteria that can sometimes threatens kind of preterm labor, but you also, if you have group B strep, you need like an extra dose of antibiotics while you're giving birth. You'll be offered immunization with tetanus and pertussis. Pertussis is whooping cough, and that's it's dangerous to little babies, so that's why we offer it to women who are pregnant, so that it protects you and baby once they're born. And then you'll be checked again for anemia. So basically, and if there's any problems with like baby, if we think it's breech or if baby's not growing, then you get more ultrasounds at this point, or maybe non-stress tests. But again, I don't do care in third trimester, so that's up to somebody else. So what if pregnancy is unplanned? So I just want to make sure you have the options in case you don't want to carry on with your pregnancy. So we've got two options here. There's medical abortions, where you take some pills, and we can provide that here if that's what you'd like. So this is if you are up to 10 weeks from the first day of your last period, or 8 weeks from conception. It requires 2 different medications, which stimulates cramps. So it's like a really heavy period, basically, and induces a miscarriage-like process. You basically need a couple of appointments where we meet in person, and then you need an ultrasound just to confirm that the embryo is in your uterus and not like in the fallopian tube or anything crazy like that, because then that requires surgery. The bleeding usually starts within hours after the medication, and there will be heavy clots with it. The cramping may be mild to very strong. Less than 1% of the medical abortions fail and need to continue to surgical abortions, and it can be done at home. And then just for those of you that are covered, like MSP covers this. And if you're not covered by MSP, then the cost of it is around $400 for office visits and $325 for the medications. However, we do not charge for our office visit, because I'm already paid salaried by Northern Health, so you wouldn't have to cover that. So you just have to pay the $325 for the medications, and I guess the $300 for an ultrasound, I think. Surgical abortions, they can be done from 5 weeks up to 14 weeks here in Prince George, and one of the physician that comes to CNC is one of the physicians that does the surgical abortions here in Prince George. And after 14 weeks up until 24 weeks, I believe is the latest, they will be done in Vancouver. The procedure uses suction. You go to the OR, and then it removes the contents of the uterus. You're asleep. It only takes a few minutes. Women may experience mild to very strong cramping sensations. There's usually not much bleeding after the procedure. There is a program here actually to put in a free IUD if you're interested in after you get a surgical abortion here, actually. Dr. Smith will usually offer that if that's something that interests you. Again, it is covered by MSP, but if you don't have that, it may cost $500. And then finally, polycystic ovarian syndrome. I talk about this a lot. It is something that it's a very complicated disorder, and not a lot of people know very much about it, and it is very difficult to kind of diagnose. But basically, it is a disorder where there's an excess of androgens, which is like male hormones in women, that can cause irregular periods, hirsutism, which is a hair growth in like a male pattern, or cysts on the ovaries. So to diagnose you, you don't need kind of all three of these, but you need a couple of them. So, and we don't need to have, we don't have to have like we can do it based on like your medical history. We don't have to have an ultrasound or blood work either. So this is what makes it very complicated in the kind of medical world, and why it is very hard to treat women, because we keep going kind of back and forth in the medical world on what is and what isn't PCOS. So it makes it very difficult for women when they come in. All right, so symptoms of PCOS: missed periods, irregular periods. I find often it is women who have very extended periods. So if you go more than 28 days between periods, that's usually a pretty indicative symptom of PCOS. Ovaries that are large or have many cysts, excess body hair, so particularly like chin, upper lip, chest, back kind of thing. Weight gain, but that is not always, that is not indicative. Like there are women with PCOS that are thin. That is not, you don't have to be obese. Acne or oily skin, male pattern baldness or thinning hair. Infertility, small pieces of excess skin, so like skin tags are quite common. And then dark or thick skin patches. So it looks kind of like, it looks like velvety skin, and it often happens on like the back of the neck or in the armpits. So the risks of PCOS, this is why this is so important that we talk about this, is that it actually happens in 1 in 10 women, so 10% of women, and I don't think we actually diagnose it that often. But it actually can lead to endometrial and uterine cancer. So when we don't shed that lining as often as we should, and that lining gets thicker and thicker, it can cause fibroids, but it can also lead to like cancer, because the lining is so thick that it abnormally grows, and then those cells grow abnormally, and then that can lead to problems. Type 2 diabetes, because it comes with some insulin resistant. So when I explain PCOS to people, there's the issues that are happening within the pelvic region, like so the cysts and things like that. But we always forget that our hormones are controlled by our pituitary gland, which is in our head, and the pituitary controls our insulin and things like that. So part of the issue is all of our hormones are controlled through our endocrine system, and type 2 diabetes is largely tied into our endocrine system. So that's where kind of the insulin resistance and type 2 diabetes comes in. It can lead to heart disease, high blood pressure, liver disease, fertility issues, and anxiety and mood issues. So there's a lot of issues that we really need to make sure we address. Next slide. So again, how is it diagnosed? So in the background, you can see this is an ultrasound, and all these are tiny little cysts in the ovaries. So one of the ways is we can do an ultrasound to look for tiny little cysts. We can do some lab work to compare your hormones to see if you have high levels of androgens, glucose levels, cholesterol levels. But mostly we just do a health history to look at what your periods and things have been doing over time. So how do we treat it? So basically, there is no cure for PCOS. So what we're trying to do is we're trying to correct the things that are causing you issues and make sure that you're healthy over time so that like you don't get diabetes and you don't get endometrial cancer. So if you have irregular periods, we're trying to make them regular. And we do that mostly by using hormones so that you get more regular periods. And unfortunately, we have to do that usually with contraceptives because that's the easiest way to do that. If you have, hirsutism with hair growth, there's some medications we can use to help block some of those male hormones. And then if you have insulin resistance, we usually use like metformin and some type 2 diabetes meds to help with that. So these are the resources I used to give you the information today, so you can go back and look at those if you want. And that's all I have for you today.